Now, every day we've been getting updates from President Donald Trump about the coronavirus with his task force right behind him and with the updated latest measures for the U.S. pandemic. So this morning, we're focused on Arizona. So joining us on the phone is Arizona Senator Martha McSally. Thank you very much for taking the time. We know a lot of work is going on behind the scenes, so we appreciate you taking the moment. First and most important question, Senator McSally. You and I spoke last week. We had talked about the testing 2 weeks ago. The president promised anybody who needed a test can get a test. We're still struggling in that area where we're hearing from Arizonans who say they are sick. They believe they might have the coronavirus, but they're being turned away at the hospital and doctor's offices, being told that unless they are severely ill, they cannot take the test. What's the delay once again?
So, Javier, this has been a challenge across the country, and part of it is, and the Arizona Department of Health Services has been working nonstop as well with as Governor Ducey's team. Part of it is the supply chain, the swabs to take the test. There is a massive shortage of them. Believe it or not, most of them, the biggest chunk is made in Italy, which was in lockdown. Some of that has arrived. There's other issues with the fluid. Look, we've been pushing on, we need the federal stockpiles to increase. We need the private sector to step up and help manufacture more. And then we need to get that out to local communities and hospitals so we can increase the testing capability in addition to the actual testing equipment themselves. So it is increasing day by day, but as the cases go up, you're going to see the numbers go up. And if you do test positive, they still, unless you need to be hospitalized, are going to tell you, go home, quarantine yourself, and get past this so that you're not making other people contagious. So it's frustrating. We're pushing hard on it. We're engaging with the private sector to help, as well with the government, working with the state. But we still need to make sure we're all in this together. And if you have those types of symptoms, you do stay home. Talk to your doctor about treatments for those symptoms, and if you do need to go to the emergency room and be hospitalized, you will go and get that care.
Let me ask you about the other states, because we're seeing those drive-up testings in other states. So what's the difference between those states versus the lack of participation in getting these tests here to Arizona?
So we do have actually a number of drive-up capabilities here, but it isn't just for people to just, if they feel like they have a cough, to go drive up. The requirements are still tight that you have to have, in most cases at some of these hospitals, that you have to have the symptoms plus having been in contact with somebody who has been tested positive or traveled to one of the high-risk areas, which now includes areas within the United States. Also working with local providers and doctors for those recommendations. Again, this is increasing daily. We've had some increased capability in the Tucson area just over the last 24 hours, but it's not for the public to just drive up. It still needs to be talk to your provider, and you're going to be evaluated to see if you meet those criteria. And we're trying to increase the criteria, of course, but we need to make sure we have the supplies, that we can test our healthcare workers, and we can test those who are in the hospital to make sure that we keep the sick and the vulnerable safe.
I have to ask you, because Arizonans are hurting. We're shutting down bars, we're shutting down restaurants. Yeah. What is your message to those folks, and how do we quickly get them those checks and that aid that they need?
Okay, this is an unprecedented situation. We are all in this together, and I know that there is a lot of anxiety out there financially because of what we're all being asked to do to flatten the curve. We have legislative language that we're working on to fast track to provide immediate relief to workers, families, seniors, anyone who earned less than $75,000 last year, to get checks of $1,200 per person, $2,400 for a couple, additional $500 per kid. In the ideally next 2 weeks, get those checks in the mail from the Treasury, as well as small businesses. What we want to do is keep employees connected to employers. Instead of having businesses and people standing in line at a government agency while they're worried about food and paying their rent, we want to use the resources that are out there. So through an authority that we have, this legislation allows small businesses to go into their local bank and apply for a specialized, it's going to be called a loan, but if you're using it for payroll and things like your mortgage or rent for your business, then it's going to be forgiven. So it's basically a grant through your local bank. We want to keep people connected, so when we turn the switch on, we can quickly get back to employing people and get that flow of resources through our community again. So those are two main things in this legislation. We hope to be pushing through by the weekend or Monday at the latest, I hope.
All right. Thank you, Senator. We appreciate your communication during these times of stress, and we wish you the best. We know a lot of working's happening behind the scenes. Thank you.
Absolutely. You know what? We're all in this together, the state, the federal level, all of society. You know, I've talked to faith-based leaders. People need, healthy volunteers at the food bank. We can help each other at the neighborhood level to go shopping for an elderly, vulnerable person. We have a public safety or public service announcement at our website, mcSally.senate.gov/coronavirus, if you want to share that. And then azhealth.gov is where you can get information from the state on the latest information, what you can do.
Absolutely. Good message. Thank you, Senator.
Great.